transmitiendo nuestra comunidad al mundo.
Good morning, everyone. Welcome to our Facebook Live session from the Mariposa Community Health Center in Nogales, Arizona. We're transmitting here from one of our clinical buildings, the Sierra building in the lobby. I'd like to thank Marco and Edgardo for putting this together, as well as the Mariposa leadership for supporting this activity. My name is Eladio, Pereira. I'm the Chief Medical Officer, and as we frequently do, we sit down and review topics of interest that may affect our community in Santa Cruz County. We are glad that you're here with us today, listening to this, and we hope that the information we provide is helpful to you and your family. And again, welcome and thanks for joining us today. There are a few things we'd like to cover this morning on our Facebook live session. The first one is a topic that we've addressed before, but I think it's important to emphasize one more time, and that's the topic of immunizations. We covered the importance of influenza vaccine this year. We do know that influenza vaccine is approved for people over 6 months of age. We also know that we'd like to give the vaccine in this era of COVID-19 to reduce the possibility of respiratory diseases, so that we can reduce the possibility of co-infection with SARS-CoV-2. Early on in the pandemic, there were some estimates as to the rate of co-infection, and it was estimated to be as high as 20%. With the influenza vaccine, we reduce the risk. The efficacy of the vaccine varies from year to year, perhaps as low as 40, as high as 70, but we feel it's a good precaution to take to prevent the onset of influenza. Influenza, as you may know, is a very distinct illness. It's not the typical cold with runny nose, but influenza typically has a rapid onset of high fever, high as 102, 103, 104, a cough, sore throat, and profound muscle aches. Very distinct syndrome. We do have some in-house testing that can be done. Depending on the technology, the sensitivity could be low, could be higher, depending on whether it's a PCR test or not. We do recommend the vaccine to prevent this illness, which sometimes can proceed or be complicated by other issues such as pneumonia as a biphasic illness, as well as myocarditis, pneumonia, and of course encephalitis. The second vaccine we discussed before is that of pneumonia vaccine. There are two vaccines available at the moment. The polysaccharide vaccine, the PPSV323, and the conjugate vaccine, or PCV13. Depending on the age and the risk factors, one vaccine may be preferred to the other. We suggest that you consult with your provider to determine which vaccine is appropriate for you. Depending on which vaccine is administered first and your risk factors, a second vaccine may be needed either 8 weeks later or a year later. So we do recommend that vaccine as well. And the third one, of course, as Dr. Williams last week reviewed, is that of Tdap, particularly protection against pertussis, which is whooping cough. Pertussis is an illness that can cause very significant cough, and in some cases can also be complicated by pneumonia. Bienvenidos a la sesión de Facebook Live. Mi nombre es Eladio Pereira. Quisiéramos cubrir en la sesión de hoy varios tópicos. El primer tópico es de vacunas. Recomendamos la vacuna contra la influenza, recomendado en personas de 6 meses hacia arriba. Influenza es una enfermedad muy específica que causa síntomas de fiebre alta, tos, dolor de garganta y dolor muscular. A veces se puede confundir con COVID-19. Recomendamos la vacuna para reducir el riesgo de la enfermedad. La segunda vacuna que recomendamos es la vacuna de la neumonía o pulmonía. Hay 2 vacunas disponibles. Recomendamos que el paciente consulte con su médico y determinar cuál es la vacuna apropiada. En ciertas ocasiones, basado en la edad y los factores de riesgo, se recomienda otra vacuna 8 semanas después o un año después, como dije, dependiendo de los factores de riesgo. Y la tercera vacuna para reducir el riesgo de enfermedades respiratorias es la vacuna que llamamos Tdap, que tiene el componente de la tosferina, que causa tos y puede estar complicada con infección en los pulmones. The second topic I wanted to review this morning is the fact that the number of positive cases in our county has continued to decrease, which are good news. We want that. We, along with other public health officials, believe that certainly masking has been the major contributor to that decrease, perhaps along with other public health interventions such as good hand washing and social distancing. We do know that masks reduce the possibility of infection. That's been shown. It does protect others, and it protects the person who's wearing the mask. Studies have shown that the inoculum, that is the number of our particles that enter either our mouth or our nose, is significantly decreased by using the mask. And it's been shown also that the number of asymptomatic infections, in other words, the infections that have no symptoms, is increased with masking. So we see less people becoming ill, even if they get SARS-CoV-2 in the mucosal surfaces. So we do recommend continuous of masking. And there's increasing discussion by public health officials about the fact that we will still continue to mask after the COVID-19 vaccine becomes available. So this is here to stay, and we do recommend masking to protect all of us. Acabo de mencionar la importancia de usar la máscara o mascarilla o tapabocas para reducir el riesgo de transmisión de SARS-CoV-2 o COVID-19. Sabemos que es muy importante para proteger a otros y protegernos a nosotros. El número de partículas de virus que entra a la superficie de mucosa, hacia la boca, la nariz, es más bajo, y como consecuencia la posibilidad de enfermedad es menor. Muy importante que continuemos usando la mascarilla. El número de casos en el condado ha bajado, y eso es buenas noticias, pero no podemos bajar la guardia. Sabemos que en otros lugares donde el número de casos ha bajado y bajamos la guardia, en esos lugares el número de casos ha aumentado semanas después. We do get some calls regarding testing, and I thought I would cover that today. As you know, there are essentially 3 kinds of testing. The PCR, the antigen test, and the antibody test. The antibody test we don't use typically for an active infection. There are other reasons to use the antibody test for surveillance, control, vaccine development, etc. But at the primary care level, we don't use the antibody test, and the CDC does not recommend that. We use the PCR test, either through a nasopharyngeal sample, a sample of the nose, and in some cases, sample of the saliva. The recommendation is as follows. If the individual tests positive for SARS-CoV-2, the CDC does recommend isolation. And there are other things that are done in addition to that. Isolation is just one, but there may be contact tracing as well to look at who might have been exposed to that individual. The isolation recommendations that the CDC provides are as follows. There should be at least 10 days of isolation from the onset of symptoms, and 24 hours without fever, without medications to lower the fever, and improvement in symptoms. If those three are met, the patient can come off isolation. It is assumed that that individual is no longer infectious. There are some situations that warrant increased isolation up to 20 days, and those are individuals who have had severe illness. So most of the illnesses that we see related to COVID-19 are either mild to moderate, and those recommendations should be followed. In those cases where the illness might be severe or the patient may be immunocompromised, the isolation can be extended to about 20 days. There are recommendations that are released fairly frequently, and we suggest that the patient consults with the provider or public health official to determine the time of isolation. But most of the time, it's about 10 days. We don't recommend retesting. We don't recommend retesting in most instances. The recommendation is if the patient recovers and remains asymptomatic, no retesting is done. If after 3 months of the illness, the patient develops new symptoms such as fever, he or she should consult with their provider to determine what the next step is. In that case, perhaps retesting might be indicated. We're still learning about reinfection. There were a couple of reports recently in which the patient may have been reinfected. So at the moment, we follow what we call symptom-based strategy rather than test-based strategy to discontinue isolation, and those individuals can return to routine activities. Recibimos preguntas acerca de la prueba de SARS-CoV-2. La prueba del anticuerpo no la usamos a nivel primario. El CDC no recomienda usarla de rutina para determinar si hay infección activa. Usamos la prueba del RNA o de PCR. Si el paciente sale positivo, se recomienda aislamiento por lo menos 10 días y no fiebre por 24 horas sin usar medicinas y mejora de síntomas. Ese es el criterio para determinar si el paciente puede terminar aislamiento. Si el paciente se recobra y permanece sin síntomas, no se recomienda hacer la prueba otra vez. Si el paciente desarrolla síntomas después de 3 meses, una consulta con el médico es apropiada. Hay otras recomendaciones para pacientes que tienen enfermedad más severa y en esas situaciones el aislamiento puede ser hasta 20 días, de acuerdo a no solamente a la severidad de la enfermedad, pero también de acuerdo a los factores de riesgo. So, no retesting is done. we do recommend, those are the CDC guidelines that we follow, and those are the guidelines that should be followed along with other trusted resources, including other academic medical centers as well. At the moment, it's important to test individuals who have symptoms. That's always been the case, and those are symptoms of fever, cough, shortness of breath, chills, sore throat, nausea, and other GI symptoms. Those individuals who have the PCR test done, we've always follow guidelines to test close contacts of people with confirmed SARS-CoV-2 infection. Close contact defined as 6 feet of distance or less than 6 feet of distance for at least 15 minutes. So we do follow that, close contact. And then there's also another category that leaves discretion for additional testing. So those are situations where congregate settings occur, and that could be particularly in schools. Recomendamos que usemos la prueba para pacientes con síntomas de fiebre, tos, dolor de garganta, problemas respirando y perder el sentido del olfato y el sabor. Pero también contactos de aquellos pacientes que han salido positivos es importante. Y el tercer grupo es discreción de los oficiales de salud pública basado en qué está pasando en la comunidad, particularmente en aquellas situaciones donde las personas estén congregadas. Then finally, I want to talk about the importance of household exposure. Increasingly, particularly in states that have had an increase in cases, household exposure seems to me the key driver. Those are situations where people congregate in their homes for various activities, birthdays, and so on, and that seems to me the primary driver at the moment. So we do recommend that people be careful about congregating in homes. When an individual comes to your home, you really don't know what that person has been, and thus creating risk. It's important to continue to wear the mask, keep social distancing, and wash your hands. Keep an eye on symptoms. Remember, sometimes the test could be false negative. If it's negative and you continue to have symptoms, please consult with us or your primary care provider to determine what the next step will be. En varios estados sabemos que la transmisión de COVID-19 ocurre en las casas cuando hay ciertas actividades, cumpleaños, etc. Recomendamos que tengamos cuidado en reducir esa posibilidad. No sabemos dónde las personas han estado, y cuando uno invita personas a la casa aumenta el riesgo de transmisión. What we've done today is review immunizations against respiratory viruses, the flu, influenza, pneumonia, and of course the prevention strategies that we do recommend. We also spoke about the Tdap vaccine. We emphasize the importance of masking to reduce inoculum. Number of cases continues to go down, which is good news, but we cannot lower our guard as we have seen other states that have had increasing number of cases after a period of fairly low number of cases. Even after the vaccine is released, masking will be recommended. We discussed testing, and we also emphasize the fact that retesting is not needed in most cases, and we've reviewed the criteria for isolation. And finally, we talk about testing in terms of symptomatic patients and close contact of individuals. Be careful with household exposure. That seems to be the main driver in some states. That's what we wanted to review today. I hope this has been useful. Next week, we'll come back with additional information on COVID-19. I'd like to thank Marco, Edgardo, Mariposa leadership for supporting this activity, and certainly we thank you for following us. Repasamos las vacunas, la importancia de la mascarilla, las pruebas de COVID y la indicación que existe para las pruebas. Le agradezco a Marco, Edgardo y el liderato de Mariposa por apoyar esta actividad. Espero que esta información haya sido útil para la comunidad y le agradezco a todos su apoyo en todas las actividades que hacemos en Mariposa. Thank you very much. Have a great day, and we'll see you next week. Have a great weekend. Thank you.
Transmitiendo nuestra comunidad al mundo.